So we're going to talk about knee pain and specifically patella tendinopathy. And what patella tendinopathy is an issue or an injury of the tendon that attaches the patella, the kneecap bone, down onto the tibia, that long shin bone from there. And so when we have the anatomy of the knee, your quadriceps come down and they attach via your common extensor tendon or your quadricep tendon there. And then as it makes its way past the kneecap down into the tibia, that's where it becomes the patella tendon. And so this commonly occurs in athletes or everyday people that are doing a lot of jumping, and that's why it's sometimes called jumper's knee. So basketballers, netballers, volleyball, gymnastics, etc., because there's a lot of force that goes down into that tendon from the patella tendon, and that can cause issues from that patella tendon. So to understand the tendinopathy a bit better before we go into actually rehabbing it, is to understand the function of why we call it tendinopathy and no longer tendinitis. So the old school saying was tendinitis, which used to be about the inflammation of the tendon, but now we actually use the term tendinopathy. And this is important because it actually changes what the focus of the rehab is. So when we're dealing with tendons, they're basically like elastic bands, right? And they're supposed to attach that muscle onto the bone. So they're meant to really quickly contract and relax. It's almost like an elastic band. Stretch out and then contract back, stretch out, contract back. Now, when we're dealing with tendinopathy, what happens to the fibers is they actually get deranged. So with a healthy tendon, they'll be tightly compact and packed together in a uniform pattern so they can slide and glide. Just like a band, right? Sliding, gliding. But with tendinopathy, what happens is that the tendon cellular structure actually starts to change and we get a derangement. We also get different types of collagen that are getting laid down in the fibers, but it's mostly to do with the changing of the cell structure. And what that means is that tendon can no longer slide and glide, so it can't act like an elastic band. And so what happens is when the force comes from the muscle contracting down through into the patella tendon, instead of it being transferred nicely down into the shin to obviously move your lower leg, what happens is because those tendons cell structures change, they no longer transfer that force adequately down into the shin bone. And so there's a lot of force that builds up through there, and that can cause a lot of pain and issues as well, because those patella tendon cells are not as capable at transmitting that force. So that's basically what patella tendinopathy is. And they can commonly occur from, like we said, excessive load on the patella tendon, but we're going to take you through a step-by-step guide to actually start to fix this issue and get you back onto the road of recovery. Now remember, as we said before, we're not too worried about the inflammation. It's there, but it's part of the healing process. We're focusing on the tendinopathy. And for that, tendons love load. So let's get into it. Okay, so as we're saying, load is the key for rehabbing tendons. So we're going to run you through a couple of quick and simple, easy exercises to get stuck into that are going to actually start to rehab that tendon. So the first one, nice and simple, is a wall sit. So we're going to come over to wall. As the name suggests, we're just going to do a wall sit. So we want the feet to be about 30 or 40 centimeters away from the wall, and we're just going to come down into sort of a half or three-quarter depth squat. We want to hold in this position, make sure our feet are facing forward, and with the isometric contraction, we're not actually moving the joint. So the muscle are contracting, they're putting load into the tendon, but the joint isn't actually moving. So coming back up, we generally like to start about 10 seconds there for each rep, and again, we're going back down. And so isometrics are really key for tendon rehab in the initial phases, and that's because the isometrics make sure that a lot of load's going to the tendon, number one, but also it can actually get the tendon to release analgesic chemicals, which act like localized painkillers to the tendon. So that's the wall sits there. Start off with 10-second holds, and we like to do about 10 to 12 reps to start off with. All right, the next one we like to do is called the Spanish squat. So grab a band, attach it around a nice stable object, and what you want to do is stand in the band. Now we like to use generally quite a thick band. You can use a little bit more of a lighter one, but when we have a nice thick bag, we can actually lean back into it and get some quite good load through there. Now with this one, what you want to do is holding onto that object, and you're slowly going to, again, lower down into sort of a pause squat or holding squat from that position there. Now with the band pulling you forward, that's going to make sure that the load comes down through the quads, into the knee, and onto that patella. Same sort of thing, we want to hold for 10 seconds here, and then coming back up. Once you do that and you feel confident, you can start to progress without holding onto the object. So it's basically going to come down to a squat position again, half depth, and then you're just going to hold in that position there without holding on. So that's how you're going to progress loading onto that patella tendon through the quads and get that tendon starting to rehab. And so the final one we like to do in the initial stage is work on some single leg. So most often you'll have patella tendinopathy single. Sometimes it can develop issues on one side and the other side compensates, but generally tendinopathy is one-sided. So with this, we're going to introduce some single leg work. The previous two were obviously bilateral. Now we're doing some single leg work. So what do you want to do this one? Sit on a seat, and you're going to have a ball, or you can actually just use the straight wall if you want, but I actually use the ball. And in this position here, what we're going to do is try and straighten out that leg as hard as we can, and again, we're going to hold, okay? So straightening out that leg, and we're going to hold there, 10-second hold, pushing into that ball as hard as we can. Again, getting some good load through the quads, coming down the patella tendon. So we're going to hold there for 10 seconds, and then relaxing up. As we said, if you don't have a ball, we'll get that one out of there. What you can actually do is just go straight up to the wall. Okay, so same thing, you want to be pushing or straightening that leg. You're going to push into the wall as hard as you can, 10-second holds, and again, we're looking at 10 to 12 reps.